Hello to our favorite listeners and viewers. This is the Ordained Radio TV Gospel Ministry, where we bring you the end time news, the undiluted word of God, dynamic praise, trending health fact and gist, talks on love, relationship, and marriage. And you're welcome back on Fit and Fabulous, your number one health program where we talk about trending health facts and talks that is actually beneficial to you, talks about your health that is beneficial to you. And I remain your host, Ajayi Adenike. So today we'll be wrapping up on our diabetes series that have been ongoing. For the past 2 episodes, we spoke about the general overview of diabetes. We spoke about the common types, the symptoms, and the causes. Then we also had a guest speaker in person of Dr. Oladapo Adetunji, who came on the show to talk to us about the WHO classification of diabetes, medication, and the therapy and management of diabetes. Please, if you missed this first 2 episodes, you can scroll down below, or you just find a link to the videos, to the episodes in our description. So today, let's go into the summary of all that we have discussed on this series, and we'll also be discussing what hypoglycemia means. So stay with us. So we established that diabetes mellitus is what happens when your blood sugar level is too high, which is what we call hyperglycemia, and that there are 2 key factors involved in diabetes, which is the pancreas and the insulin. The pancreas being a very vital part in the body that actually plays role in blood sugar regulation by producing insulin, and the insulin is what helps glucose to enter into cells for energy. And we established that we have 2 major types of, amongst other types of diabetes, but 2 major types, the type 1 and the type 2. The type 1 being a condition whereby the immune system actually attacks the cells that are producing insulin in the pancreas for unknown reasons, while the type 2 diabetes is actually the most common type, and it is where the body does not either make enough insulin or the cells does not respond to the insulin, thus leading to high glucose level in the bloodstream, causing diabetes. And so we established that the common symptoms for hyperglycemia is excessive thirst or urination, fatigue, feeling dehydrated, blurred vision, having slow healing sores, then feeling weak and tired all the time, excessive thirst and urination, fatigue, weight loss without trying, blurred vision, having slow and healing sores. And we said that there are different causes for diabetes. So it can be lifestyle factors such as lack of exercise, excessive weight, taking in a lot of sugary drinks, or it could be genetics. It could be insulin resistance, which is the type 2. It could be due to autoimmune conditions, and it could also be due to age, age factor, which is the risk of type 2 diabetes increases after a person is 45 and above. So then Dr. Oladapo Adetunji also established the WHO classification of diabetes, which he classified into 3, which is the normal, the pre-diabetic, and the diabetic. And this is actually established after series of tests, which is the fasting blood sugar, when they check the blood levels for glucose, and they are able to establish, they measure it according to a specific range of determinants to determine if a person is diabetic or if a person is at risk of getting diabetes, which is the pre-diabetes. And also he also spoke about the medications that can be used in managing diabetes, which can be oral, which can be inhaled, and which can be injectable. So it can be oral medications, it can be injectables, and it can be inhaled medications. And also he also admonished that you shouldn't stop taking your medications, especially if you feel that your blood sugar level has come back to normal. You can only stop taking your medication. You can only stop taking your medication when you have been cleared to by your physician. So please don't stop taking your medication unless you have been cleared, and also don't skip your appointment dates. Also, the therapy management also talks about the awareness and education of diabetic patients and everyone that are around that person, the immediate family, the friends. It also needs to be educated so that they know what to do in cases of crisis. Diabetes is not a death sentence, so people should be aware and it should be effectively managed. The lifestyle needs to be changed accordingly. So briefly, let's go into what hypoglycemia means. All of this is hyperglycemia, when the blood sugar level, the blood glucose level is too high. Now, what happens when it's too low? Hypoglycemia is a condition in which your blood sugar level, which is the glucose level, is lower than the standard. Now, this is lower than the standard. Hypoglycemia needs immediate treatment, which involves quickly getting your blood sugar back to normal within the standard range, either with a high sugar intake through food or drink or with medication. And how do you know you are having hypoglycemia? Symptoms like looking pale, shakiness, sweating, headache, hunger or nausea, feeling hungry, fatigue, dizziness or lightheadedness. These are symptoms of hypoglycemia. Also, in severe case, there could be loss of consciousness or seizures. This is why people around diabetic patients need to be aware and educated properly so that they know what to do in case of crisis. Because somebody that is unconscious cannot speak, this is what is wrong with me, or this is what I'm going through. So immediate family and friends needs to be aware of what to do in cases of crisis, especially when the patient is unconscious. So loss of unconsciousness is also a symptom of hypoglycemia. Now, when you feel any of these symptoms, you should eat or drink something that will increase your blood sugar level very fast, such as taking drinks or taking glucose. Now, low blood sugar usually affects people with diabetes, people who are taking insulin, or people who are on other diabetes medication. So because they have been on this medication for a long time, it's possible that the medication can now so reduce the blood glucose level, reduce it below normal. So this often happens to people that are on medications for diabetes, and it really happens in people that do not have diabetes. So if you have hypoglycemia, do not skip or delay meals. Now, in this case, you need to eat on time and you need to have a steady intake of meals so that the blood glucose level in your body will be normalized. You have enough glucose to do a lot of work to go on with your daily activities. If there is no glucose, we established that glucose actually gives energy through the food we eat. When we eat and we take in, and the body converts what we eat into glucose. The glucose is used for energy. Now imagine when you have to go work, you do hard work, and you have hypoglycemia and you skipped breakfast. Obviously there's no energy for you to continue in that work. So you need to not skip your meals and you need to eat frequently. So at this point, we'll be drawing the curtain on diabetes series. If you have any question, please do drop them in the comment section and we'll attend to it on our next episode. So thank you so much for staying with us. Please share, like, and subscribe. Share to your friends and family. Let them be a part and let them also learn from what we have for you on each episode. Thank you so much for joining us. Follow us on our social media platform on Facebook and on YouTube at Ordained Radio TV. I remain your host, Ajayi Adenike. I will say, stay healthy, eat healthy, don't skip your appointments, don't stop taking your drugs, and live a healthy lifestyle. Bye.